We are going to be doing a bent knee side plank. This is a plank progression that puts a little bit less stress onto both the shoulder and the core. To start, I want you to pick an area. Like you can start at your knees and like checkpoint up, or you can start at your shoulder and like checkpoint down. But there's things that need to happen at each body part. So I'm gonna start with my shoulder. I want my elbow to be stacked under my shoulder. I don't want it out here. I don't want it tucked in. I want it to be directly under my shoulder. And this is going to be when I push up. And so you may have to experiment a little bit with like where does it need to be for your starting point so that when you push up, it is stacked underneath you. The next body part that we're going to be aware of is our midsection. When we get into the full movement, I want this to be flat, not hips flexed. I don't know why you would choose to extend them, but don't extend them. Nice and neutral. So for my body, I'm in a slight degree of hip flexion when I start, and then when I engage up into the side plank position, I'm flat. Similar thing would happen if I went into a full plank. I'm not going to be, oh my God, I don't even know how you would balance. I'm not going to be piked with my hips forward in this shape. Tends to happen in a side plank for some reason. So just be aware of it. Finally, knees. Knees are going to be in line with our hip when we press up. I want them to be stacked together. This can be kind of painful for some people's knees if you're like a especially bony human. Something underneath, like a yoga mat or maybe a towel, and then if you need to put something in between, you can as well. Okay, we are going to take a breath in as we press up into this shape. Make sure we're stacked. We're not rotating pelvis forward or back. Nice and neutral. And then we're going to breathe. Inhale, exhale. On the exhale, imagine a slight lift in the pelvic floor, a slight zip of the clit, these two pubic bones being pressed together, and then inhale and exhale.